Hello, I'm Kelly Arthur with Health Quality Innovators, and we are here today to introduce another idea that works at Montgomery County Fire and Rescue with Captain Jamie Boltrotsky to introduce their mobile integrated health units.
Mobile integrated healthcare in Montgomery County, Maryland with Montgomery County Fire Rescue started in 2014. We started with 14 patients, and we sent those patients to our Health and Human Services, just the names, and to see if there was any touch points that they could identify that they could maybe increase services to. And they did, and the following month we noticed that their 911 calls had significantly decreased. It was a very non-scientific type experiment, but that's what showed us that we were really onto something to try to address our frequent users, because we last year ran over 93,000 EMS calls that we can't sustain that growth each year. We're increasing our growth 3,000 calls a year. In 2016, we had 33 patients that were enrolled, and we were able to reduce their calls by 55%. When we approached our hospitals, they were completely on board. They knew what we do as EMS providers, so the relationship was already established. We just had to figure out the best way to integrate both of our agencies together. When we first started back in 2014, we really didn't have any resources. It was me in a staff position that didn't involve anything having to do with mobile health. And we were fortunate enough that our leadership was supportive of this and allowed us to kind of farm out some of my other duties to other people to focus more on mobile integrated health. We also have a team of about 10 paramedics that work on overtime aside from their regular shift doing our home visit program. We're hoping that we can get either positions into the budget, in the county budget cycle, grant funding, money from hospitals potentially. We've got a few different ideas, and hopefully as this program evolves and people understand more about it, we'll be able to have a better way of getting some funding. So once we receive a referral and we research the patient and we find the correct resource that we want to utilize, we will call the patient and tell them about our program and explain what we'd like to do. They'll allow us into their home. We set up an appointment, and when we go to their house, we will do a home safety check. So we check smoke detectors, we check for fall prevention, anything unsafe in their home. And then we'll do an assessment of their medical needs, their social needs, and dive a little deeper into their lives and figure out what we can do to help them be better, more healthier people.
Hey, Tommy.
Hey, Jerry, how are you?
Have you ever had to make a EMS referral?
Yes. I've been fortunate enough to make them probably about 5 times in the past 30 days, so with our frequent users here in Montgomery County.
Tell me a little bit about the process, about how that went.
So it's a pretty simple process. So essentially, at the bottom of our narrative, we have a bullet point that we can choose for our frequent users. We click on that bullet point saying yes, that they need a referral to the EMS office. And then from there, we can document it in our narrative on what the issue was with that frequent user.
That's terrific. So it was an easy process for you?
Yes, wasn't complex at all, very easy to use.
That's great, because we know you guys run a lot of calls here. And
yes,
you're up all
especially
night.
here at Station 32.
Yes, definitely. So what happens, I'm not sure if people realize what happens after you click that button, is that we get a report the very next day.
Okay.
And we click on it and read through your narrative. And then we read through, sometimes we'll do some research from the history of that patient through
right.
CAD and other resources. And then we can refer that patient out to a variety of resources within Montgomery County. If there seems to be an issue where nothing really fits, then we can do a home visit ourselves and go follow up with the patient.
Oh, that's great to know. I don't really know much about the program, so thank you for sharing that.
Now you do.
Some of the challenges that we've faced thus far, one of the biggest ones was how do we share protected information, HIPAA. We had to make sure that we signed memorandums of understanding with each of the hospitals that we're working with, and that takes a lot of time. And so each hospital does things a little bit differently. We all have the same end goal, and that's for our patients to not call 911 and not be readmitted to the hospital. but each hospital has a little bit of a different outlook on how they do that and what their resources are. Another challenge that we had was that we had to work with our regulatory body. We as paramedics and EMTs function within a standard set of protocols, and our state agency didn't know what to do with mobile integrated health. This is a new concept, and so that took a lot of time to work through and talking it out, and meetings, and we're still working on it, but we're in a good place, and I think mobile integrated health definitely has a place in the state of Maryland.